of Governorship and States Assembly is midnight of March 9, 2023. Speaking on allowing inmates to vote at the 2023 election, Sani said it is, I quote, at the discretion of the National Assembly. If it is a law, INEC has no option but to implement the law, and once it is passed by the National Assembly, people in correctional centers will be allowed to vote. Well, this tells us that election year, of course, we know is next year, but campaign begins this year. So by the time you start seeing the politicians campaigning, you make up your mind on who you want, make up your mind on what you want. I think Nigerians should get to the point, we have gotten to the point of not being cajoled to vote for anybody because of benefits, because of gains. Let's allow our conscience work for once. Let's allow those that actually have the interest of Nigerians at heart to be there. So you have to, it's important for you to vote. Remember to go get your PVC so that your voice can speak. That is the voice you have. That is one way to speak. So go get your PVC and be part of what is going to happen in this country next year, as to go out there to choose who will take leadership positions, whether at the central, at the state, assemblies, or anywhere, or even local, wherever. You know that in some states and all that, they are to go through local government elections. Let your PVC speak for you. Go get your PVC to be part of the national elections that will take place next year. All right, let's look at something very pertinent here. This has to do with one organ in the body, and some people do not even know how important their kidneys are. Now, this story has it that Nigerians have been advised to take proper care of their kidneys to enjoy longevity, as kidney failure may lead to untimely death. The advice came in during this year's World Kidney Day celebration, which was held at the hemodialysis unit
in further
at the
kidney
University of
screening,
Port Harcourt Teaching
encourage
Hospital, Juba.
transplantation as the best
Our correspondent
option
Melvin
for kidney
Jack, who
failure,
captured the event,
and the
said
act of
9
organ
health
donation
tips
as a
were highlighted
life-saving
to keep the
initiative.
kidney healthy
World Kidney
and
Day
functional,
is
which
observed
include
every 10th
eating
of
healthy,
March.
keeping
Here in River
active,
State,
and
it was celebrated
fit,
in Port
that is
Harcourt,
exercising,
to create the
controlling
awareness
your
of the
blood
importance
sugar,
to the overall health
controlling
and to
blood
reduce the
pressure,
frequency
monitoring
and
your
impact
weight,
of kidney
drinking of
disease
plenty
and
of water,
associated health
avoiding
challenges.
smoking,
Organized
and of course
by
be
the
aware of the
International
amount
Society
of
of Nephrology
out-of-counter
and the International
pills
Federation
intake.
of Kidney
Have your kidney
Foundation's
function
featured health
tested
talks,
if you're
screening
at risk.
at the
Let's see
University of Port
reports.
Harcourt Teaching Hospital Community. World Kidney Day is a global campaign aimed at raising awareness of the importance of the human kidney. Each year, hundreds of organizations and individuals launch initiatives and events to commemorate the World Kidney Day, creating awareness about the disease and what could cause kidney failure, possible preventive measures, risk factors, behaviors, and treatment to live a healthy life. The human kidney is a bean-like shaped organ situated in the body, just like other internal organs like the liver, heart, or intestines. It is one vital organ of the body responsible for the filtration of blood and water to eliminate waste to keep the body healthy and alive. As such, care must be taken to guard the kidney to function properly. World Kidney Day started in 2006, and every year the campaign highlights a particular theme, with this year's theme, Kidney Health for All, Bridge the Gap to Better Kidney Care. Government at all levels have been called to take proactive measures and invest in further kidney screening, encourage transplantation as the best option for kidney failure, and the act of organ donation as a life-saving initiative. World Kidney Day is observed every 10th of March. Here in River State, it was celebrated in Port Harcourt to create the awareness of the importance to the overall health and to reduce the frequency and impact of kidney disease and associated health challenges. Organized by the International Society of Nephrology and the International Federation of Kidney Foundation's featured health talks, screening at the University of Port Harcourt Teaching Hospital Community, screening of school children, as well as the general awareness topics about kidney-related cases. Dr. Pedro Chioma is a senior nephrologist at the nephrology department of the University of Port Harcourt Teaching Hospital, and Professor Ifeoma Anochie, a consultant pediatrician, University of Port Harcourt Teaching Hospital and Rivers State University Teaching Hospital. Both enumerated causes of kidney failure as they relate to children and how mothers could notice the symptoms of kidney dysfunction at an early stage.
In this environment, the most common cause of kidney disease is hypertension. The second one is what we call glomerulonephritis, which has to do about the inflammation of the kidneys. Then, of course, nephrotoxins. In this environment, we know people consume a lot of herbal medications, a lot of substances, and a lot of them could actually be hazardous to the kidney. Then, of course, there are some other conditions, infections. We know about HIV, we know about hepatitis B and C, and other infections. Even COVID itself also been known to cause kidney problems. So what to do is to be aware of these factors, we call them risk factors, because those are the things that lead to the disease. So if we have hypertension, we need to check to make sure our blood pressure is within normal range. If our blood pressure is not within normal range, if you are hypertensive, we need to ensure that we do all it takes, including medications, to control our blood pressure. Also, our diet, salt is an important part that needs to be controlled, because high salt intake, generally we know, can even cause hypertension.
Kidney problems start even in the womb. Right. And that is why you want to tell women to be careful what they take, what they do in pregnancy, because it can affect the development of kidneys. So you have those that are due to maybe what the woman has taken, a congenital problem, and some cannot be explained by any of these, right? So it can start in the womb. The development of the kidney starts very early in the first, even before the woman knows she's pregnant. That is at the point where the kidneys start developing and start functioning such that by third trimester, that is towards the end, the kidneys are well functional. Avoid going to all these TBAs. Monitor the pregnancy. Do the necessary ultrasound at the time your doctor recommends. Watch out your tummy. If your tummy is not growing as usual, as the baby is getting older, the tummy, because it's producing this urine. But if it's not producing, which means there's something with the kidneys. So you report early. Let's pick it up early and treat, because early treatment gives a better chance. But some of this will lead to what we call end-stage renal disease, and the child will ultimately need dialysis and transplantation, which is the main treatment.
Delivering causes of kidney failure and ailments, head of nephrology department at the University of Port Harcourt Teaching Hospital, Dr. David West Manda, Metro Nephrology Unit Anayo Wilfred expounded on the functions of kidney and how to be cautious about things that could lead to acute chronic kidney conditions. Said the human kidney is a delicate but vital organ that must be treated with care. They advise patients of kidney cases not to see it as a death sentence, but should seek medical attention and also avoid consuming herbal concoctions that could endanger and damage the kidney and other organs in their bodies.
Right now, kidney failure is increasing. As in, many people they come down with kidney failure. You know about dialysis, Abby? Most people that are doing dialysis have kidney failure. Once the kidney don't fail, that means the kidney they fit doing work again. And some of the work of working in the field, to share you don't hear from the first speaker. One of them are waiting. Tell me one work working in they do. They remove waste from the body. When body swell, water plenty. If your kidney they work well, you go commot the waste from the body, you go feel the peace out west. I mean most of us our body like not be so good. If the kidney don't fail, that means the kidney don't feel work that in work where it's supposed to work. And kidney failure. We get what we call the acute kidney failure and the chronic kidney failure. If you get a family person who gets kidney problem or when they hypertensive, it will make you check your BP. High BP they cause kidney failure. If you don't treat them on time, if sugar they high too, diabetes, they cause kidney failure. If you know chronic kidney failure, there are even some drugs where we take. Those medicines where they cause acute kidney failure.
Those small things you can do that can keep you healthy. They are very simple. They are not difficult things that you cannot do. Drink a lot of water. The weather is so hot, so that you can keep yourself hydrated. Check your blood pressure. When you are ill, go to hospital on time so that Whatever the problem is can be checked early. Monitor your blood pressure, monitor your blood sugar level. The kidney is too vital for us to joke with. The kidney is too vital for our sustenance, for our life here on earth. So please, let us be careful how we abuse it.
Other resource persons added that when the kidney is stressed and starts to malfunction, the patient begins to observe swollen legs, body tiredness, and lack of blood in the body. They advised on restriction from alcohol and abstinence from smoking, and also said that moderation is needed in anything anybody is doing.
Structure of the kidney, that the structure of the urinary tract, which part of the body, where the part of the body where the kidneys are, and then how the kidney works. So the urine you pass, the kidneys are responsible for producing urine. So if you take drugs, medications, or even herbal concoctions, anything you take, once that blood gets to the kidneys will collect, it gets filtered. So if that thing you have taken is dangerous or harmful to the kidneys, it will go and damage that filter.
When people get diarrhea, they purge. Some parents go say, if they grow teeth, they go take and say, now one of those things. The pikin go they purge. So body water finish. When that one happen, the kidney go suffer. Kidney will fail. And that's another problem. So that's why we are talking of things that we can do to prevent us from getting there.
On his part, Secretary, Rekip Kidney Foundation, one of the support organizations, John Chinedu Ede, who testified of the benefits of kidney test and possible transplantation on the founder of his organization, has this to say.
That our founder, just like all of us are seated here, hoping that we are well, and started noticing all the symptoms, some of the symptoms you've been told here by the experts, and eventually went to the hospital and was diagnosed of kidney, failure.
So basically what we're doing as a foundation is to try to promote their awareness and, if possible, the knowledge of kidney diseases. So we collaborate with the hospital and other hospitals to try to help to counsel patients and where necessary to support in some way, maybe financially.
I have benefited a lot. I have already also noticed that there are some food we take that are dangerous to kidney.
They talked about acute kidney failure and chronic kidney failure. So now we've had to understand that there is difference. Where the acute is a sudden breakdown of the kidney, the chronic is a progressive deterioration of the kidney. So with that, I know we've learned so much.
As much as possible, please take care of yourself. Avoid